Please welcome to the stage Shirley Ann Higuchi, Associate Executive Director for Legal and Regulatory Affairs.
Welcome. Welcome, everyone. I hope my mic is working. I went to the bathroom and then everything fell down and I had to get replugged up. So if you can't hear me, let me know. Well, I really like what Dr. Kanter had just mentioned, and I want to put a plug in for our Monday plenary, working with insurers. We're really lucky this weekend that we have representatives from Aetna Behavioral, as well as Optum and Anthem Blue Cross Blue Shield that will talk to us about what they're looking for from psychologists and what they're looking for from our leadership here today. So as many of you know, the APA Practice Organization had a very successful multi-state summit in New York, as Catherine mentioned earlier. And that was in New York last May. It was a real challenge because with our restricted resources, we had to really rely on our partnership with the states to pull together, to charge registration, to market the program. And you know what? We were completely sold out. And for that, I have to thank the New York State Psych Association and the New York State Neuropsychological Association for partnering with the Practice Organization, the Pennsylvania, Connecticut, New Jersey Psychological Association. So I want all of you to stand today and be recognized, because without you guys, we wouldn't have been able to put on that summit. So let's give them a big hand. And this was completely on a shoestring budget. And what was great about this is we put a little money back into the State Psych Association and used it as development to try to plan ahead for the future. But I got to tell you, it's not easy. We're hosting our next summit in Washington, D.C. And it's going to be a tough one because the jurisdiction of the District of Columbia and what goes on in Maryland and Virginia is very different than what goes on in other states, as well in the Midwest. But on May 20th, I invite all of you, if you're able to come down to the APA headquarters, to join us for another summit where I'll get local payers to come to that summit that are active both in Maryland, Virginia, and DC, and hopefully Pennsylvania, who actually just recently joined in to be a partner, to come over to the APA headquarters and participate in this great summit. So can I get those state psych associations to stand? Because I'm not going to be able to do it without you. Come on, guys. Pennsylvania, DC, Maryland, Virginia. And I really need you guys to step up the plate and market this program so we can bring in money to the states as well as to support the practice organization. The big kahuna one that's coming down the path is Chicago, June 24th. I got to really thank the Illinois Psych Association for being the sponsor of this one. And we were able to garner the Michigan Psych Association, Ohio, Minnesota, Missouri, Indiana, and Alan Nessman and Connie just told me that Kentucky and another state signed up. Wisconsin, we got that last minute. So I have to ask all you guys to stand up too, because I really got to rely on you to pull that one off. Again, this is without a budget. So that means we got to get registrations up, and guess what? We are going to raffle 2 tickets to the summit of your choice. If you look behind your badge, apparently there's a ticket that you could place out by the charging hub where the phone place is. There's a Capitol building model. You just stick your card in there, and you could either choose an online version to come in, or you could actually come in town and actually participate in either DC and/or Chicago, your choice. And the drawing will take place on Monday evening, right before the state leadership banquet. So the multi-state team, and I am wearing my button here, even though I don't know if I was supposed to, but if you see Alan, Connie, or Javier wearing the button, please approach them if you would like us to come to your state and partner with your other state associations to put something on in your jurisdictions, or if you have questions or you're interested in participating in any way, maybe you have a special expertise, please feel free to talk to any of us. But these summits and state leadership this weekend will give you a sampling of what to expect in these multi-state summits in various jurisdictions. And if you're interested in purchasing the New York pilot, the New York State Psych Association, I know Tom Cote, you're here someplace, just wave them down because we actually recorded it and we've been able to develop an educational module for that. So tomorrow morning and the rest of the weekend, what are you going to experience? You're going to experience a drilling down of this opening session that you just heard today. A drilling down of the big models that Jeffrey talked about, and also the drilling down of the independent practice models that Dr. Ruddy spoke about. Also, on Monday, we have a legal and risk management issues, where we partnered with the trust to develop cutting-edge risk management issues in these types of models, as well as bringing in a lawyer that can help talk to you about what you need to prepare for in the event that you want to pursue any of these models. So thank you so much for coming. And I will be calling Drs. Ruddy, Evans, and Kanter back to the stage for a Q&A. Alan, Connie, and Javier will be manning the mics, but please feel free to ask any question you desire. I think we have about a half hour left for the program. Thank you. So I know there are a couple of mics out there, but I'm going to open it up with one question. So what are the areas of growth and change within the profession that you see as most hopeful for our profession? And I'll open it up with Nancy.
I think the fact that this is where we're focused for our state leadership conference, the fact that we have these summits going on, really shows the openness that I think has happened in the last number of years, where people are starting to think bigger than previously. And I think I hope the next layer on is going to be to see summits that are not only across states, but also across professional organizations. So I know Susan's doing a wonderful summit on integrated primary care, and we're going to be inviting people from all different disciplines. And I think that's a model for where we need to head, because otherwise it looks like we're just out for ourselves, and I'd like to see us be part of that healthcare dialogue in a broader way.
Okay, great.
I think from my experience, the growth of a group, the growth of people getting together, whether it's under one roof as an employee-based model, or if it's a group of independent practitioners getting together with multiple services, multiple areas of expertise, multidisciplinary, as I mentioned, it opens a door to growth, to go into hospitals, to go into primary care, to go into, actually, on Friday we just signed a deal to provide services for the St. Johns County in St. Augustine in Florida, to provide consultation services for the 911 operators. This is not something that I had ever envisioned we would ever do. These 911 operators are traumatized every day with every single phone call. So to have a group, have enough people with different areas of expertise that you can expand and branch out into other areas that you never would have thought about, to me that's a growth area that I never would have envisioned.
Well, I think that this idea of population health is really important. I think it's going to take off. And the reason I talk about it in terms of trends versus fads is because you can look at ACOs and whatever the newest models that are out there are, but the trend that's underneath all of those is this notion that payers like myself are going to increasingly put provider systems at financial risk, give people responsibilities for taking ownership, so to speak, over the health care of individuals. That's a trend we're going to see continue, and I think it's ripe for psychologists. I think that it's uncharted territory, it's a frontier. I think it's going to take a lot of innovation and creativity, and I think that the skill set that psychologists bring, they're really optimized. I think we are optimized to work in that kind of complicated environment.
Thank you. I see a question right out here.
It's on? Hi, my name is Steve Bloomfield. I'm from Florida. I'm a former president of the Florida Psychological Association. I'm a federal advocacy coordinator, and I'm a late career psychologist who has a private forensic practice. I accept that we're moving in a different direction and away from small independent practices. As a leader, as a state leader, however, I know we're going to talk about membership issues on Monday, but as a state leader, we see our state association membership falling. The Practice Association membership has fallen by something like 40% over the last year or 2 years. I'm curious from the people who are developing these larger systems what the role of a state association or practice association has if I'm affiliated or become affiliated or employed in a larger institution. And that not only includes the institutions and entities you were talking about, but hospitals, VAs, universities. My practice needs and advocacy are going to be fulfilled by those institutions and entities and diminish the need, I think, for state associations and the practice associations. I'm interested to hear your perspectives on that.
Okay, Arthur?
Sure. I think it's a great question. I actually don't think that the kinds of certainly the changes that I'm talking about are going to diminish the role of state psychological associations. I've been in government and policy positions the last 20 years. You know, I was in Connecticut, I was a member of CPA. In Pennsylvania, I'm a member of PPA, because I think that those organizations make our field stronger. And I think that, you know, certainly what I've tried to do in my career is, even though I work primarily in the policy realm, is to use what I know as psychologists, use what I know that psychologists can bring to help enhance the field. And so I think that, if anything, it's going to make what state psychological associations do even more important in terms of helping people to see some of these trends.
Thank you. I see a question right here. Right, you. Yeah.
Hi, good afternoon. Jorge Wong, President of the California Psych Association. I'm really interested in hearing more about how you were able to work on the population health part to increase psychologists as a requirement of the RFP in working in the Philadelphia program. I work in an FQHC in California and also really big into public behavioral health. And due to cost, oftentimes California's 58 counties, which actually hires a lot of mid-level folks, like a lot of master clinicians, rarely include psychologists in their array of mental health providers. And I'm wondering how you were able to put that onto an RFP, because I'm really curious as to how to actually put it onto a state mandate to hire more psychologists in the public health sector. Sure.
I could do it because I'm the commissioner, bottom line. And they do what I tell them.
My man.
So I am serious, but seriously, you know, I think that's why I think it's so important for us to be in policy positions, because I sit in so many rooms where people don't understand who we are, what we do. They make bad decisions as it relates, and you've heard some of them already. You heard Catherine and what Shirley was talking about. So I think it's really important for us to be in those policy positions so that we can, by fiat, say, this is the way it will be. You have to have, if you're going to have this kind of a program, you know, if you have to have psychiatrists, if you have to have nurses, you have to have psychologists. And here are the reasons why. So just to give that context. So I don't know if I answered all of your question, but that's how
Thank you. We got Connie over here with a question.
Hello, my name is Travis Lochran. I am a graduate student at the University of Nevada, Las Vegas, and the Regional Advocacy Coordinator for the Southwest region as part of the APAG's ACT team. And I have a question. I think it's really exciting talking about expanding the practice spectrum, but from a graduate student perspective, where most training models are still kind of the traditional current practice spectrum, what recommendations do you have for graduate students to prepare themselves for this expansion, or also recommendations for programs themselves to adapt to the new models?
Nancy, well, I was going to have Nancy respond, and Joe, if you want to do follow-up.
So I think that there is an evolution occurring in training right now. Commission on Accreditation did look at this very issue, and we talked about the importance of creating room. You know, right now I think that the programs are so locked in to what they have to train on, it's challenging to create space for alternate models. But there's places to do it. I mean, in the practicums that either are developed or that students can help develop, where you go on internship, what kind of postdocs you do, as well as just the mentorship that you seek. So one of the things that I want everyone to know, actually, Barbara Ward Zimmerman is sitting right there, and I want to give her enormous credit for being part of a committee that we have putting together a course on integrated primary care that will be a plug and play, because part of the problem we have is that very few graduate programs have anybody on their faculty who's ever worked in primary care. So how do you teach it? So we created this course that's just like plug and play. Like, it doesn't matter if you've never done it. We'll support you. We'll tell you what you need to know. And you can at least do some foundational and then even subject matter modules. So that's going to be released very soon. And that was one of the main kind of needs we saw. In addition to that, on the Education Directorate website, there is a list of places that offer training, particularly in primary care. But I think as a student and it's APEGS, I really encourage you guys to go talk to your faculty and say, look, we want to make sure that our training experiences are preparing us for the kind of jobs that are going to be out there eventually. And so, yeah, it's great to be in a counseling center, or it's great to be here, but how do we get out? So for example, in a college counseling center, guess what? They're usually right next door to the health center. Okay. So, enough said.
Thank you. Jeffrey, quick follow-up.
Specialize, coordinate, integrate, get an MBA. That would be helpful.
Or MPH.
Or MPH, that would be fine. But that's the future. I mean, that's what you got to do. And it takes, if you're able to do that, and you're able to grow something, and then it goes back to what Arthur was saying about putting psychologists in policy positions, is beyond that even. It's putting psychologists in positions of influence. Blue Cross Blue Shield asked me to be on their advisory board for the state of Florida. I'm advising them on ADHD testing, that kind of stuff. What's going to happen? What happens if they do this? How are psychologists going to respond?
Okay, I got a question right here. Alan?
Hi there, Terry Strong from Oregon. I just want to let everyone know, 18 months ago, I launched an integrative care private practice in Eugene, Oregon, and we're still in business, and we're growing exponentially. And so for the gentleman who just spoke, we have postdocs as part of our program, and we're going to try to get a predoctoral internship going. But my question, my reason for coming up was for Dr. Kanter. In our state, there's a large movement toward independent practice associations, and I was wondering how your model of the management services organization is similar or different to the IPA model?
It's complicated. An independent practice organization is different than a managed service organization, but it has some similarities.
Jeffrey, I can take that if you
maybe,
want.
I was going to say maybe
Yeah,
Alan.
let Alan take this one.
I think that may be better.
Terry's standing right next to me. So the MSO, as Kevin Ryan will say on Monday, is it's sort of a IPA on steroids. Okay. Or as I like to say, it's a promiscuous IPA. And IPA is really designed to primarily serve one payer. MSO is designed to market more broadly. And the other difference, which you'll see in Dr. Kanter's model, is it isn't just creating a network, it's providing a lot of management services. So those are two of the basic differences, but we'll be talking about those more tomorrow morning at 11.
Come by tomorrow. Javier, you have somebody over there?
Yeah, hi, it's Tom Swales from the Ohio Psychological Association. Jeff and everyone, how can the state psychological associations facilitate the creation of MSOs, facilitate the growth, incubation? What role will we play in making that happen?
It's a good question, and actually, I don't know if Vince is out there, but Vince has been very involved with the Pennsylvania Psychological Association, which is, I think, he's going to talk about tomorrow as well. But the support of the state organizations, I think, is really important, and making sure they get the word out, making sure that they help get the information out about what the MSO is, I think, is really important. What's critical here is to understand that your state organizations, APO cannot do this. You can't go to APA and say, where's my EHR? You can't go to APA and say, can you create this for me? I'm paying my dues. Where is it? So I need the support to be able to do this. It's not an easy thing to develop, and it requires people's understanding of the information that's going out there. So I don't know, communication is important. We're just starting off on this, so
I would suggest that you try to corral Alan or myself after this, so we can talk more about it. But I wanted to move to the question that Alan has now.
This is Brian Stagner. I'm Director of Professional Affairs in Texas. I'm interested just in hearing a little more information about how either in the integration with medical practices or in the community psychology kinds of outreach things you're doing, we all can see there's some distal outcomes. The population health is going to get better. And all of the individual things you talked about seem like good ideas, but what data will you have to sort of justify or to decide this intervention really is paying off in those distal outcomes? For example, what would you look at to decide doing those murals was really worth doing in terms of population health, or doing some of these other things that you guys talked about? Just how are you going to document and justify your budget in a way?
Sure. That's a great question. So, being a psychologist, of course, we evaluated the mural work. Actually, Jack Teebs at Yale evaluated the mural project, and we found effects at a couple of different levels. At the individual level, we found some effects in terms of people perceiving their communities to be, this is at the community level, people who had not even participated in those projects feeling that their communities were safer because of the change in the environment. And if we think about the whole idea of social determinants, one of the things we know is that how people's community context looks has a direct bearing on their health outcomes. So that gives us some glimmer of hope that we can do these kinds of community level interventions and have an impact even on people who didn't participate in the mural process itself. We also found individual level effects in terms of people's self-advocacy around their health status. So, these things I think can have those impacts. And again, I think this is why it's important to have people who can help figure this stuff out, try things, evaluate them, and decide whether or not we should continue them. One other thing that I'll say, I talked about the Engaging Men of Color initiative, where we're looking at African American, Latino, and Asian men because we're not getting the kind of access for some of those groups. One of the things we look at routinely is penetration rates, and so we're constantly looking at the proportion of the population that's accessing services. So that would be the kind of thing that we would look at to see whether or not we should continue these kinds of strategies.
Javier, you have a question over there?
Yes, Barry Katz, president of the New Jersey Psychological Association. We're having a difficult time with our early career psychologists, especially in New Jersey. We have permit holders who have great restrictions upon how they can practice, how many hours, and intensive levels of supervision are required. However, they're competing against social workers, licensed professional counselors, and other professions that don't have such restrictions. So we find that in many of these settings that the administrations will hire these other professions because they don't want to have to pay for supervision and time and the paperwork required that we put upon our early career psychologists in regulatory as well as statutory means.
I think it comes down to legislative advocacy. I think that each state, and this is why this particular conference is so exciting to me, because each of you has your battles to fight. And I live in Mountain Lakes, New Jersey, so I feel your pain. New Jersey is a very difficult practice environment for psychologists right now. And I think the State Association has done a lot of wonderful things. Our focus, personal opinion, is that we really, again, have to get off the reimbursement and on these bigger policy issues and being recognized for what we bring to the table. Until quite recently, there was actually a law in the books in New Jersey that you could not provide medical services and mental health services through the same door, okay? So I also think that there's great opportunity in our state. So the Mental Health Association, there are some other advocacy groups that really want to partner with us. And I think that as in all states, and I really think one of the themes of our talk today is numbers. Like, there is power in numbers, whether it's a service management organization or public health or primary care and doing things differently. We've got to partner with other people who share our same agenda of trying to help our states, our populations be more psychologically healthy. And I think those laws in New Jersey are not helping. And we have many crises in New Jersey, particularly with opioid addiction. And so I think there's a lot of places we can partner with those other organizations and try to improve. Let all boats rise. But
thank you.
God bless you. Power to you, dude.
Hi. Oh, okay. Here. Okay. Hi, Lainey Ducharme. I'm probably one of your senior psychologists that's been in private practice for 30 years. And I guess one of the questions I have is, I think a lot of people are not aren't trained to be business owners. And I also think a lot of people don't want to run a business of 20 or 30 or 50 or 100 psychologists. I'm very active in 42, and I guess having come from 30 years ago, a behavioral medicine business, because I'm a nurse also, so I've trained in behavioral medicine, I'm wondering what your thoughts are on people in independent practice who are pretty successfully working almost like partners without walls with clinical practices around, with pediatricians, with obstetricians, with various people, and being able to encourage some of our young people to not necessarily, if we looked at that model of the senior student, senior psychologists can still do private practice. As we move downwards, we can't. But just what are your thoughts and how can we encourage young people? Because I do think there are going to still be a percentage of the population that would like that private practice model. So I'm wondering your thoughts on all of that.
I mean, what I would say is mentorship. I mean, I think that our early career people are looking for mentorship. They're looking for ways to be successful. And you mentioned something really important, which is that those partnerships in the community become referral sources. But as a private practitioner, make yourself useful to your community. Do a needs assessment. Figure out what isn't there now and fill that need, and you'll be successful. Because I agree with you. Actually, we were laughing before because I said to him, you are so entrepreneurial. I would never, ever, ever have the guts to do what you did. And I don't think I'm alone. I think a lot of us just are not built that way. So I think it's important that we recognize there's going to be a whole continuum of ways to be a psychologist going forward. Private practice not going to be part of it, but it may look a little different than it does now, or it may be part of someone's work life, not their entire work life.
The MSO model that I'm talking about is built specifically for folks that are in independent practice, that don't have to leave independent practice, that have good successful practices, but are worried about what they don't know. What you're going to find out in my talk tomorrow, how I got started on this in terms of some of the growth stuff that I got involved with, and how I started a group with Vince and a few other folks, is because I got scared to death what I didn't know. And the more I knew, then the more I became afraid of what I didn't know. So I needed to find that stuff out. So the folks that are in private practice, I mean, if you're in a fee-for-service, if you're in a self-pay model, all the power to you, that's fine. You don't really need to know that much. You don't have to worry about Medicare, PQRS, whatever. But if you take insurance, you're worried about rates, you're worried about HIPAA, you're worried about even faxes now that used to be not part of HIPAA. If you're faxing electronically, guess what? You're now part of HIPAA. There's issues that you got to deal with there. So even if you're an independent private practice, late stage, late career person who's pretty successful as it is, it's worth looking into the components of components of what the MSO offers, and then figuring out, oh, I'm already doing this fine, I don't need that. Oh, but what's this over here? Tell me a little bit about that. And then saying, I'd like to access that piece of the pie because I didn't even know it was a problem for me. So I think it's built for that.
Okay, is there a question right here down the center, Alan?
Yes. Oh, no.
Oh, no. Okay, over here?
Yes. You thought you could quiet me by taking the microphone away from me up there, huh? Listen, 30 years ago when I started what I think was an innovative practice at the time, with some other colleagues doing similar kinds of practices, there was some pushback from sort of more established psychologists in the state. They saw the entrepreneurial kinds of approaches that myself and some others in the state were taking and were a little intimidated by it, concerned what it meant for the practice. Over time, what we were doing became the mainstream. And I think we have to assume that what Jeffrey is doing and what Arthur and Nancy are talking about are going to be the mainstream in the next decade or so. This is where psychologists are going to be getting the training. And it is unfortunate. We do have some issues in our field with making sure that our training gets aligned with the realities of practice. That's true in any discipline. The disconnect between training models and practice. We can make that more reciprocal, I think, and there are lots of things that we can work on to do that. But getting back to what the SPTAs can do, because most of the people here are representative leaders of SPTAs, so that's what I really wanted to talk about. I think you can be welcoming to people like Arthur and Nancy and Jeff, to your conventions, to your conferences. You can participate in the summits that Shirley talked about. There are lots of opportunities to put on programming and, to the extent possible, maybe engage in some of the more innovative educators in your state who might be willing to participate and talk about what they're trying to do at the training level to connect up with some of the more innovative kinds of things going on in the practice world. I think forming committees in your association, when I got involved in this whole thing, at the time, I was encouraged by the person who then was heading up what was called the HMO committee in our state to create what we called the Insurance and Managed Care Committee. At the time, people bristled at the idea, a managed care committee? You know, it was our effort to address the problems that were occurring from managed care. You have to innovate and evolve your SPTA to address the current realities, and the current realities are the things, amongst others, that Nancy and Arthur and Jeff talked about here today. So I really want to say the SPTAs can be the laboratory for lots of great ideas. And I finally want to finish today by just expressing a tremendous amount of gratitude to Shirley and Nancy and Arthur and Jeff and obviously to Catherine. I just think we had a phenomenal lineup of speakers today. I am goosebumps today with what I heard and the way this went. And I just really want to thank all of you.
Thank you, Dan. I really appreciate the comments that Dan made about the role of state psych associations, and I didn't mean to sort of cut that conversation short earlier, but the whole point of the summits is to engage the states, have the states partake and participate in our success along with the practice organization and our staff. So I hope that all of you will talk to us about the summits. I have one last question for each of the speakers. And it really has to do with, if you could give us one advice for these state leaders to take home today, what would that advice be? And I'd like to start with Nancy.
I always get to go first. I don't know what that means. So I think that the one thing that I would love to see everyone do is get outside our boxes and really ask yourself, why am I doing this way? Because often we do things a certain way because we've just always done it that way. And to do that with every decision you make, question, ask, and get people involved who are not part of your group. One of the challenges that we face in any professional organization is everyone's so busy. There's always a core group of people who give up their time and give service back to their organization. And I've been part of those groups, and I've met some of my favorite people in the world doing that work. But I will also say sometimes you get into groupthink and you get into well, we know what's going on and those people out there that aren't engaged don't. This also has to do with membership, which is if people are not coming to you in droves, then there's something you're not giving people that makes them not feel that you're relevant to them. And that idea of a needs assessment, that idea of what can my state association do that's going to make people knock our doors down because we're giving them something they need, I think that's the keys to the kingdom. But it's much easier said than done, and I realize that. And all of you deserve enormous credit for the amount of time and energy you put into our field. I can't thank you enough.
Jeffrey and then Arthur.
I don't know if it's advice. I just give the message back that things are very good in the psychology world. Things are not horrible. Things are growing. Things are getting reimbursed better. There is more influence with insurance companies. In my world, and it's expanding, things are only going to get better, and there's no need for whining, complaining, moaning, groaning. I mean, you hear it all the time. It's not necessary. There's lots of things and positive and innovative practices to get involved with for people. It's good out there. I mean, these are your APA PO dollars at work bringing you the good news that things are good out there. You know, if you look for it, if you sit at home in your office and you just look at your Aetna insurance bills and that's all you do all day, you're going to whine and moan and groan and complain. If you get involved in integrated care, if you get involved with the police, if you get involved with whatever areas that nobody else has thought of, it's great. And people are willing to pay for it. People want your expertise. They're willing to pay if you can show them your outcomes and why what you're doing is helpful. It's good out there.
Thank you. So Arthur.
Good. So they stole my thunder. The two of them. I think, I started by saying I love being a psychologist. I think our profession is one of the most undervalued in our society. I see so many problems. I'm trained in experimental as well as community and clinical. I use all of that every day when I do my work. And I see so many challenges. I agree. I think there's so many issues out there. And I don't think it takes a lot of effort to reach out to schools or to police or to child welfare systems or to whomever. I think there are a lot of things that we can do. I think there are a tremendous amount of opportunities. And I think, the challenge for us is going to be how do we convert those into, opportunities that help us financially, but in terms of the opportunities being there and the need being there, I think it is there. And I think if we can reach out as a profession to these various systems, I think there are lots of opportunities. So what I would say is lean into the current healthcare environment. I think that there are a lot of opportunities there. And one other thing, for you graduate students, remember what you're doing in statistics, okay? I just want to tell you that. We need people who understand data in our field.
Well,
How to write grants.
Oh, and how to write grants.
How to write grants.
Yeah, thank you. Well, thanks everyone for coming. Thanks to our online registration folks that dialed in. And thank you to our speakers. I'd love to give them a big round of applause. And we look forward to seeing you at the other workshops. We have a terrific lineup. Read your program. It's excellent. Thank you.